Good afternoon, Abbey Delray South residents. Jennifer Stevens here with an update for July 23rd, 2020. You should have received a letter last week that was distributed on Friday from our new CEO, Jesse Jansen. It spoke to some changes that are being made within LifeSpace to help better manage our finances and become more efficient as a company. Jesse also stated that each executive director would be filling in the details for each community. So here are your details. When SQLC and the Texas communities joined LifeSpace last year, we inherited a second office located in Addison, Texas. Along with several members of the senior leadership team, moving forward, Jesse Jansen will be based out of LifeSpace home office there. Having a strategic presence in a major metro market will bolster our recruitment efforts as we strengthen our organization while reducing travel expenses. The office currently located in Des Moines will remain operational, but on a much smaller scale. Our new CFO, Nick Harshfeld, who joined the LifeSpace family on June 29th, will work out of the Des Moines office along with some of the other finance department team members. The team that remains in Des Moines does not travel, so it makes more sense for them to remain in that office. As our Texas communities become integrated into LifeSpace, we will soon transition to operating as 2 regions instead of 3. Florida and Illinois will combine to form 1 region. The other region will be comprised of Texas, Nebraska, Minnesota, Pennsylvania, Kansas, and Iowa. Florida and Illinois both have multiple communities that total a total of 7, whereas the other states have a combined total of 8. So it basically balances out. We will move from 3 regional operation directors to 2. Ann Walsh's role as Senior Vice President of Operations will be eliminated effective January 31st. A new role, Chief Operating Officer, is being created, and the search for an individual for that role will begin immediately. We thank Ann for her 4 years of service to LifeSpace and wish her well in future endeavors. With the immense responsibility of driving and maintaining clinical quality across all LifeSpace communities and the current pandemic illuminating the need to reframe our approaches to disease prevention among team members and residents, we have expanded Dr. Sarah Ham's role. Reflecting the revised role, Sarah will be promoted to Chief Clinical and Public Health Officer from Senior Vice President of Successful Aging. We are so very happy for Dr. Ham, as she is a valued asset to our organization and continues to keep our health centers in compliance with federal and state regulations while remaining instrumental in ensuring we are always providing quality care to our residents. Sales and revenue are vital to the future success of our business and our ability to deliver on our promises. It is also an integral part of the operations of our communities. We are changing the reporting structure of the community sales teams to now report directly to their executive directors, as they had been reporting to the regional sales directors. This empowers us as executive directors to lead our communities in the direction that we feel is most appropriate. This also includes some upcoming changes in our relationship with our marketing partner. We will be looking to bring more of our marketing efforts in-house, which will significantly reduce costs. I know this is a lot of information and there will still be more forthcoming. Please feel free to reach out to me anytime if you would like to discuss any of the information provided. Update on COVID-19. Health center residents remain COVID-free. Health center staff was tested this week and will continue to be tested every 2 weeks ongoing. As of today, we have 1 positive team member who is doing well at home under the care of their doctor. Recently, I have been asked why we are not testing the private aides that come into the residential living area of the community. The answer for this is because they are not Abbey Delray South employees. They are the residents' private employee. If you want your employee to be tested, please ask them. They can go to their doctor or any walk-in medical clinic for a test. Then they can present you with their results. I would recommend that you ask them to do this. We continue to screen every private aid at our front gate, and we'll continue that process. Please do not wear a plastic face shield as your only face covering. This does not protect you or anyone else. These face shields are designed for the eye protection of medical professionals providing care, not for the general public. You must wear an actual face mask that fits tightly across your nose and mouth to be in compliance with our policy. If we see you with the face shield and no mask underneath, you will be asked to return to your home for a proper face covering. I understand the plastic shield is more comfortable, but it is not intended to be used without a fitted face mask. This concludes our town hall. As always, I thank you for your support. Have a great afternoon.